The Clinical Diagnostic Laboratory at the National Hansen's Disease Program performs highly sensitive real-time polymerase chain reaction, or PCR, to help diagnose Hansen's disease, also known as leprosy. This test is mostly done on skin biopsies taken from active lesions, but a variety of other tissues can also be tested. The PCR test can distinguish between Mycobacterium leprae and Mycobacterium lepromatosis, the two bacilli that can cause Hansen's disease. Due to its high specificity and sensitivity, this real-time PCR test is a valuable tool for detecting extremely low quantities of M. leprae and M. lepromatosis DNA in tissue samples. Using bacteria-specific reagents, the PCR process can amplify specific portions of bacterial DNA from a very small sample, allowing us to detect the presence of Hansen's disease-causing bacterial DNA in the original tissue sample. The PCR test is especially useful in diagnosing challenging cases with low bacterial loads, such as Pauci bacillari and pure neural cases of Hansen's disease, as well as atypical presentations. PCR test results can help clinicians and patients to make informed decisions regarding Hansen's disease treatment and management. The PCR test is performed on formalin-fixed paraffin-embedded tissues, or formalin-fixed tissues that we can process for paraffin embedding. For PCR testing, it is best not to fix tissues in formalin for more than 24 hours. Ideally, no more than 2 4 to 6 millimeter full-thickness skin biopsies should be in one paraffin block, and excess paraffin should be trimmed. Larger tissue samples should be avoided, as that can cause problems with the PCR process. If an auto-embedder was used, then tissue samples must be re-embedded without the plastic cage prior to submission. Shave biopsies should also be avoided, as it reduces sensitivity, so a negative result may not be used to rule out Hansen's disease. PCR tests cannot be performed on tissue sections on slides. For shipping, use cold packs during the summer months to prevent paraffin from melting. When submitting unembedded tissues in formalin, be sure to use a leak-proof container and select overnight shipping to preserve sample integrity. If drug resistance testing is requested, the laboratory can use the same formalin-fixed, paraffin-embedded tissue to determine if M. leprae is resistant to rifampin, dapsone, or ofloxacin. Please note that drug resistance testing for M. lepromatosis is not yet available. Researchers at NHDP have also developed an RNA-based assay to determine the viability of M. leprae in patient samples. Viability testing can be used to monitor treatment efficacy in multibacillary patients and can also be useful in suspected relapse cases. The viability test can only be performed on skin or soft tissue samples fixed immediately after collection in molecular grade 70% ethanol. Tissue samples fixed in formalin cannot be used for viability determination. This test is not yet available for M. lepromatosis. Please ensure the pathology consultation request form is fully completed and submitted with your specimen. Be sure to include your fax number for reporting purposes and clearly specify the requested test procedures. The NHDP laboratory is Joint Commission and CLIA certified, independent of the National Hansen's Disease Program Clinic. If you would like the NHDP clinic to review and consult on your pathology results, please check the appropriate box on the form. This authorizes the lab to share results with our clinical team. Incomplete forms may cause delays in processing and reporting of results. If you have any questions about the Clinical Diagnostic Laboratory at the National Hansen's Disease Program, please call 225-756-3733. For all other questions and concerns, call our main number at 1-800-642-2477. You can access our website at www.hrsa/Hansens-disease.